Hi, everybody. Good evening. Welcome to Evoke Therapy Program's broadcast. I am Dr. Brad Reedy. Today is Wednesday, March 20th, 2024. So I'm really happy to be doing this one. I haven't done it in quite some time. And it was really inspired by some questions I received on a Q&A a few weeks back where people were asking about how they can support their child or their grandchild or their relative in treatment. And what got me thinking was how we are more similar than we are different when we think about diagnosis and mental health. I think one of the things that one realizes once one starts to work on their own mental health is that we have more in common, and the defenses or the walls that we put up when we're feeling threatened or unsafe are the things that separate us from each other. So I'm really happy to be talking about addiction and self-medication tonight. Before I go into our content, I just want to announce that we have our next version of the Conscious Parenting Seminar that will be held April 12th. I'm going to be hosting that all day. It's an all-day event starting at 9:30 a.m. to 4:30 p.m. Mountain Standard Time, Mountain Daylight Time, actually. And it's $400 per person, $700 for a couple. I'll be teaching and lecturing in the morning. In the afternoon, we'll have an hour for lunch, and then we'll have breakout sessions in between where you can discuss things in your smaller group. So I look forward to that. The day goes by absolutely quickly for me. I love that day, April 12th. If you have any questions, contact admissions at evoketherapy.com. Look forward to that. So let's get into tonight's broadcast talking about self-medication and addiction. First of all, when we talk about defining addiction, the diagnostic manual mentions it in terms of these criteria. Does somebody have a significant tolerance increase? Does it take more of the substance or the behavior for them to experience that dopamine hit, that high? If they withdraw from, if they cease to participate in the substance use or the addictive behavior, is there some kind of physical or psychological withdrawal, distress that comes from that? Do they use longer and longer periods of times as they go along? Um, do they spend their time obsessing about the thought when they're not using, when they're not participating? Do they look for it more? Do they think about it constantly? Um, are they losing other activities and other outlets in their lives, other relationships? And does this behavior cost them? Really, the defining line, if you will, of mental illness between mental illness and mental health is that idea that when it starts to cost us, people ask me all the time, when is it too much? And the answer, generally speaking, is that it starts to cost us. We start to pay for it. So we have lots of good reasons to stop the behavior, lots of common sense, sensible reasons to stop the behavior or the ingestion of the substance, and yet we don't because of this pull, this draw, this repetitive pattern, this compulsion in our bodies. Now, I want to distinguish what the diagnostic manual says between what people in recovery, people in the 12-step community talk about. In the 12-step community, specifically, it's all about self-diagnosis. When we think about, and I think this is really relevant if you have a loved one that you're concerned about, it's really relevant to remember that in terms of treatment, it doesn't matter if they meet the criteria. You can't convince somebody because the addiction itself is embedded in or surrounded by illogical thinking, irrational thinking. So in that sense, really, it doesn't matter. I often say when somebody's talking about it from a spiritual sense, not from an insurance or a diagnostic sense. I mean, as a therapist, I have the right, the obligation, the authority to diagnose people that I'm meeting with in my mental health practice, my addiction practice. But in a treatment sense, in a spiritual sense, it's really none of your business whether or not your child, your spouse, your friend, your brother, your sister, your parent is an addict or an alcoholic. In fact, that hyper focus on that label becomes a part of your disease, becomes a part of the distraction or the disease that we call codependency. Focusing on somebody else and somebody else's cure as a means toward your own serenity, your own peace of mind. And I'll talk about that a little bit later. So that even applies to young children. We again, this goes back to a core principle and not just in parenting, but really in psychology that I talk about all the time, which is you don't have to be right. You don't have to justify or rationalize your choice or your opinion about something. You get to have your feelings. You get to have your perspective. So if you have a child, a 15-year-old, 16-year-old child, using substances, misusing substances, you don't need a professional to ratify your opinion that this child might need help outside of the home, or this child might need some boundaries or some consequences related to their behavior. You get to decide that, and as they grow up, they get to decide the same kinds of things. So when we go away from the idea that we have to be right, it has to be ratified by some professional, by some criteria. That's one of those moments that we're entering that old idea that you live by the sword, you die by the sword. You're going to argue it until your voice goes out. And the fact of the matter, not only does it not have usually a positive effect, an effect that causes the person to wake up and see themselves more clearly, but it actually has a negative effect. You become hyper focused on it, and the person that you're concerned about pulls farther and farther away. So when I'm talking to a parent who's trying to make an important, big decision for their child, or somebody that's trying to make this big decision for their life, and they ask for my ratification of it, my response is, you get to decide. And what might be comfortable for me might not be comfortable for you. And that doesn't make it right or wrong. This is about becoming your authentic self. And when we can embody that and model that, especially for our children, talking about this in terms of a parenting context, then we're modeling for our children that they get to decide. And what that's going to do for them is that's going to keep them out of toxic and abusive situations and relationships in the future. They won't be as susceptible to be talked out of it by somebody. But if your family, and I have been guilty of this for sure, sometimes still fall into this hole. If your family is guilty of trying to be right, who can prove their case the best in this kind of virtual court of law that is our family, we really handicap our children with an idea, a sensibility where they have to prove to their boyfriend or girlfriend or partner that the abusive relationship doesn't work for them. If we embody this idea of you don't get to be right, you just get to be a self, then they don't have to prove it to anybody. They can walk away from any situation where they feel uncomfortable. So let's talk about self-medication in general before we talk about it rising to the level of addiction, of that diagnosis. First of all, I'll start off with the quote by Carl Jung that I have loved for many, many years. Most of my career as a therapist, I come back to this quote where he said, neuroses, you can substitute the word mental illness or mental unwellness, psychological unwellness. Neuroses is a substitute for legitimate suffering. So when somebody is cutting, refusing school, acting out, misusing substances, compulsively addicted to gambling or to sex or to any other process addiction to computer screens, they're oftentimes substituting this approximation, this thing that feels, at least temporarily, like they want to feel. And even though those behaviors cause their own kind of suffering, right? Substance use disorder has with it natural consequences, health, law, general life functioning. Even though there are negative consequences for that, that is still less than the authentic suffering, the legitimate suffering, as Carl Jung calls it. So the treatment is to go into the suffering. That's what those quotes mean by the poets that say that the answer for the pain is in the pain. The cure for the suffering is in the suffering or through the suffering. So I used to do this parent workshop many years ago, for many, many years, hundreds of workshops I would have each week for families that were visiting our program. And I would often ask for self-medicating behaviors. What are examples of things that people do to avoid pain and suffering? And even though I phrased it very, very intentionally, what are things that people do or what are the things that we do? I found a pattern to be true every time, every single time of the 100 workshops. People would list things like cutting. That's not my thing. But of course, that is a wonderful and powerful distraction from legitimate suffering because it's directed inward. And people tend to feel sorry, be alarmed by it, be wonderfully distracted from the conversation that we ought to be having, which is what's going on? How are you feeling? So cutting, drugs, of course, running away from things, school refusal, promiscuous sex, computers, TV, other kinds of screens, aggression, acts, fighting out, arguing, conflict, blaming. But in all of my years of asking this question at the outset of this parent workshop I would have each week, not once, not one time did a parent mention workaholism or working too much. Not one time. And what that suggests to me out of I would guess there was at least 400 classes that I taught. Out of the 400 classes that I taught, not one time did a parent mention workaholism as a possible self-medicating behavior. It tells me, reminds me of the fact that we think about other people's problems so much more easily than we think about our own. We think that the problems to our life, to our serenity, are out there. And if we have a child, it is a very convenient place to put the problem into and onto the child. And then if the problem is to our peace, to our happiness, to our serenity, to our well-being is in the child, then we spend our time trying to fix and shape up the child. And we even use communication like you made me feel this way, and the diagnosis, the symptoms that you're displaying, let me tell you how they're affecting me. And we think because of our own training that somehow is supposed to medicate or excuse me, that somehow is supposed to motivate the child to want to change their behavior. But I'll offer the idea to you tonight that I think that kind of communication, that kind of thinking is actually in part what the child or the other person is often medicating. That pressure, that anxiety that comes when you're told to believe, you're taught to believe that you're responsible for taking care of other people. And if it's a child being asked to take care of a parent, that is too great of a burden for a child to bear. They are not designed for this. But because we come into parenting with our own unhealed wounds, we are so often asking the child to do for us something that our own parent should have done for us, which is create that internal sense, that internal base of safety that happens in a secure attachment that we carry around with us wherever we go. And we're asking the child for unconditional love, for the ability, we ask them for their ability to hold our pain, to hold our sadness, to be responsible for it. So then the work becomes learning how to feel. The cure for the pain is in the pain. And the development of resiliency, and I'm going to talk about this throughout the broadcast tonight, there's a lot of things that help build resiliency, but what we understand from child development, from attachment theory, is that the principal contribution that we parents, we adults can make to a child, can foster in a child, our primary contribution is a secure attachment. That is to see them clearly, to respond to their needs adequately, not perfectly, but adequately, to welcome who the child is, who they are, how they feel. And when we welcome the child and see the child clearly, the child then becomes who they are. And later in life, they don't need to substitute with drugs or alcohol or other behaviors. They don't need to substitute something in them that will give them that same feeling that people have when they feel safe and secure in their lives. So the development of resiliency is fostered by attachment, which in short is a parent's ability to see the child as they are and to respond to them as that person. Now, what is required? What's the prerequisite for that ability in an adult or a parent to provide that kind of experience for a child? They have to sort out their own attachment wounding. They have to unlearn much of their own conditioning in many cases. They have to take a really tough examination at their own childhood. And the research is clear about that. So we parents self-medicate. Everybody self-medicates. Self-medication, when taken at its lightest level, is really just self-care. We do things. Nobody can work all the time. Nobody can be under stress all the time. Nobody can hold all the world's pain. Nobody can scroll through their media or news feed on their phone and take in all the world's trauma in real time for the whole 8 billion people on this planet. We just can't do that. We have to find ways to soothe ourselves. Excuse me. That's a hard thing for me to say tonight. We have to find ways to soothe ourselves. And the trick is to find ways that don't lend themselves to this addiction and compulsion. So we are not that different from our children. And the more we can embrace that, it doesn't make you incapable of setting boundaries and holding children or others in your life accountable. That's the great fear. There's so much fear that we have if we let go of judgment and shame. Even though on paper, I think most people listening to me would say, well, of course, we need to do that. We need to let go of judgment and shame and fear. But the fact of the matter is, in practice, we're afraid that if we remove those things, that there'll be no guardrails, that we and the people that we love will devolve into chaos and hedonism and a hyper focus on individualism. But that's not the way that it works. That's the fear. That's what we've been taught. But the fact of the matter is, it's messy for sure. Becoming who you are, finding out who you are, figuring yourself out is messy, and you're going to make mistakes. But ultimately, that's the way that one finds themselves. That's the way that one develops, is by experimentation. The key to this work is to treat the cause rather than the symptom. And again, I suspect everybody hearing me say that will say that's the oldest idea that there is. But we don't do it. I find myself struggling with it. I just said it to my wife a couple of week and a half ago. I said, with the big decisions, the ones that we can make slowly, right? There are decisions that happen all day long, and you can't really take it through this thought experiment that I'm suggesting. But with the big decisions, the question is it well based in attachment? Will this further the bond and the sense of safety with my child? So we have to look past the things that trigger us, past the cutting, past the substance abuse, past the addiction and the compulsive self-medicating. And we have to see and understand what's going on with the child. We still have to make decisions, but there's a profoundly different kind of energy that comes when we're looking at the causes, the root issue, rather than its symptom. You know, when I was first introduced to addiction ideas in literature, I remember the big push, and there still is today, and many people talk about this, and there is research out there that shows that it is a predisposition genetically. There are twin studies. There are studies out there that support this idea. But for me, it doesn't matter, because I think the greatest benefit of understanding that it's genetic or organic is that it takes the judgment out of it. And the fact of the matter is, whether it's organic, whether it's nature or nurture, meaning your environment, the things that happen to you, the fact of the matter is I have the same compassion for both. The key is to take the shame out of it, that this is not a character defect. This doesn't make somebody bad or less than. In fact, in my experience, most of the people that I admire in my life personally have suffered from addiction in their lives. Talk about it openly. Attend meetings where they confess it each time they introduce themselves as an alcoholic or an addict. So the key is to take the shame out of it, because shame is what we're medicating. The fear that we're going to be rejected, that we're unlovable, that we're not worthy of connection, worthy of attention. And we all have some of that. The key for family members is to learn to take care of yourself. Rather than asking the person suffering from addiction or self-medicating, instead of asking them to get better so that you can sleep at night, is to learn to take care of yourself, so that when you show up to that relationship, it can be in the service of supporting them and instead of in the service of supporting you. We know that the effect of drugs and alcohol on young brains is different than it is on adults. There's a critical stage from about 12 to 25, give or take. This is called the adolescent brain, the development. There's a critical point in human development where introduction of substances like these wire the brain for addiction. They short circuit the dopamine reward system, and the person is more likely to become wired for addiction. Later on in life, that hardwiring is really hard, if not impossible, to reverse. So when I talk about with my children about it, I talk about my consequences, my limits, my opinion. This is where I come from. I'm gonna do my best to stave off as long as possible those kinds of compulsive substance ingesting opportunities, behaviors, patterns. Once we reach adulthood, the window of opportunity for major remodeling of the brain shrinks. It becomes less plastic. It's more difficult to alter it. Alcohol specifically acts like a computer virus in the brain by slowing it down or shutting down brain activity, deleting or distorting neural messages, damaging neural connections, hindering formation of mature brain wiring, delay of gratification, frustration tolerance. Like I said, it basically rewires the brain's pleasure reward system, which can lead to dependence and addiction later on in life. It absolutely makes it more likely. And really, when we're talking about this, we're talking about this cross section, this matrix where there's always an organic component. And there are people today that are talking about trauma, very popular people today who are saying it's not the environment. And that's ludicrous. Nobody thinks that. People come with a predisposed brain, DNA, genetics, and then depending upon the amount of stress that they're exposed to, depending on their vulnerability, their susceptibility, that equation answers the question about whether or not they develop an addictive pattern. In the early stage, often thought of as experimentation and entry point, it could start with cigarettes, it could start with smoking pot and drinking these kind of gateway drugs that we talk about. It leads eventually to stealing medications from parents. School problems start to begin. School problems are probably the number one indicator that parents pay attention to. They start to violate rules, start to violate parental norms, parental values. Oftentimes, because it can be difficult and exhausting, we can be inconsistent in our consequences. The ability to control use is there in these early stages, but tolerance is starting to build. Often in the early stages, it's a way to connect. Adults use it. Adults who don't have problem with alcohol use alcohol as a social lubricant. So it only makes sense that that would be inherent in the development of a child's substance use history. Fitting in is a goal in adolescence, being a part of the group. So there's a lot of pressure, even when it's not stated. I remember people talking to me about peer pressure when I was a teenager and I was using substances. And I used to explain, I said, my friends are absolutely 100% supportive, overtly, of me not using. But the fact of the matter, if that's all they're doing, right? My good friend had a wonderful Volkswagen van with curtains parked in the parking lot of our high school. And if on breaks and during lunch they were in there smoking pot and I was with them, eventually I would end up smoking with them. Attention span decreases, focus decreases. Again, lower tolerance for frustration starts to increase. The interesting thing I always think about people in the early stages of substance use, sometimes even the late stages, is when parents think that they're using because they're agitated, that's when they're not using. When they're using, they're pretty cool. They let things slide. As this starts to develop more and more, we talk about the habitual and abuse stage. There's usually at this point some attempts to limit their use either by themselves or by others. Blaming increases. The types of drugs start to expand, oftentimes become more illicit and dangerous. I will tell you, since I was younger, that people will go from zero to heroin or from zero to fentanyl a lot faster than they did when I was growing up. And that's frightening. Withdrawing from the family and friends, changing peer groups, stealing, lying, academics decline even more, truancy increases, mood swings. Of course, it becomes a way of life. It becomes a hobby. It becomes the identity. A preoccupation with drugs. When I was a teenager, it was making pipes and bongs. When we weren't smoking, that's what we were doing. Arguments within the family, legal difficulties, of course, and then, of course, all along tolerance is increasing. In late stage, where it's considered dependency, there's usually more significant consequences, suspensions from school, legal problems, anxiety is increased because again that dopamine reward system is now misfiring. They have to be high or using just to have a baseline of low anxiety. Blackouts, passing out, withdrawal symptoms are more obvious, at least in agitation, like I mentioned just a few moments ago. Using alone tends to increase. They will talk about a lot of people that identify as alcoholics or addicts will tell you that the first time they used was the first time they felt normal. So for people developing this more gradually at this stage, at the dependent stage, that feeling, that sense is increasing. Anger outbursts when they're not using, like I mentioned. Denial, stops trying to hide their use. It's overt now. Binging or daily use, stealing, dealing, any act, prostitution to get money or drugs. Weight gain or weight loss. Of course, high tolerance or withdrawal. And the identification with the culture at the dependent stage is fairly complete. But the question comes to me all the time, what what's the difference between the approach that you would use based on experimentation or abuse or even to the level of dependency or addiction? And my answer is almost none, particularly with underage use and drinking or drug use at any age, illicit drug use. Sometimes when somebody says to me, I'm not an addict, my response is, that's great news. I'm not saying that sarcastically. That's great news if you're not an addict. So let's work a healthy program so that you don't become an addict, so that you don't develop that level of dependency. See, treatment and prevention are virtually the same behaviors. So all the things that you get asked to do if you have a family member in treatment or if you yourself go to treatment for substance use disorder, all of the therapeutic techniques and family work that's done are really modeled after what a secure attachment is: healthy communication, ownership of feelings, the ability to listen, to regulate the nervous system, right? All the things that we would do to fortify a child against addiction are the very things that we do when somebody's suffering from an addiction. Individuals who begin using drugs as juveniles are at a greater risk of becoming addicted compared to those who begin drug use as an adult due to the immaturity of the teenage brain, particularly the part of the brain that controls impulses. I was once sitting at a conference and somebody asked a question on a panel. What would you say to a young adult who had obvious signs of addiction but was in complete denial of it? What would you say to convince them, to show them? And I participated in the panel, and my answer was, I wouldn't try to convince them. I would try to make them feel safe. I would try to reduce shame through my non-judgmental presence. I might even share some of my history with them to put them at ease. I might share even more relevant, I think, some of my present day history about how we all self-medicate. I'm trying to reduce the threat response, right? Because substances themselves and the defenses that we have to protect the substance use, those are all put in place because the person doesn't feel safe. So we try to reduce shame. We try to reduce judgment. Dr. David Sedlak said, He described addictive thinking as a person's inability to make consistently healthy decisions in his or her own behalf. He points out that this is not a moral failure of a person's willpower, but rather a disease of will and the inability to use the will. The peculiarity of addictive thinking, he says, is the inability to reason with oneself. I love that. I made this model. I borrowed this model from a couple of different places many years ago. And I wanted to share it again tonight. This simple cycle that take any moment, take a stage of life, and we'll call that contentment. And then there's a traumatic event, either a need that it is needed that we have that doesn't get met, or some traumatic intrusive event happens. And then we have these undesired emotions, right? Sadness, fear, shame, guilt, stress, right? We have undesired emotions, things that don't feel good. And then we develop these coping skills, getting drunk, lying or blaming, violent outbursts, cutting, any kind of self-destructive behavior. So what is the antidote for this? The antidote for this is to start to tell your story. Communication skills. Communication skills aren't as much about communicating with another person. They really are not. At least in my experience, that is not where I've seen the great benefit of communication skills. The great benefit of communication skills is the ability to work through our own feelings and thoughts ourselves. It's really about communicating with ourselves or for ourselves. If I could tell somebody feel and they would just feel, that would work. But that doesn't really work. So we say, let's talk about it. Let's explore it. Telling your story, sharing your feelings approximates feeling. It gives you a platform to express the feelings in a healthy way. But the key is you have to do it in a safe place. If the person on the other end of the communication gets defensive because it's about them, if the parent says, no, your childhood was a lot better than that, or that didn't happen, it shuts things down. If the person just tries to fix it because they don't want to see you suffering, you might be suffering legitimate grief and loss. But if a person offers platitudes, you again have the unconscious sense that it's not safe to share your feelings, that they're not welcome. And you don't learn how to feel them, and you don't learn how to sit with them. That's the great benefit of listening to people's feelings as a therapist or a parent or a partner. If we can sit with them in their uncomfortable, distressing feelings, they can learn to sit with themselves. That's how it works. And then, of course, through that process of feeling your feelings, you integrate, you become more whole. You don't get rid of them, but they become a part of you. Everybody can relate to a sadness, to a grief, to a loss, to a pain that they have felt and worked through. And now it buoys them up in some way. What was once a weakness or a wound now becomes a strength, oftentimes to help other people that are suffering in the same way. I remember when I was first a wellness therapist 25, 26 years ago, they had this workbook. And they had this simple drawing where they had pain and grief, this kind of arrow going horizontal, and written inside of this arrow was the words pain and grief. Then they had these two arrows pointing in opposite directions, saying this is the wrong way. You have to go through the pain and the grief, and that's the way that we come to contentment. We integrate. Doesn't go away, but it becomes a part of us. Like that I believe it's the Japanese art of sealing together broken pottery by the glue. The scar, in essence, becomes the art, the beauty of us. It becomes our humanity. I wrote this just this morning as I was preparing for the evening. I wrote, substances can temporarily fill a spiritual longing in us, replicating the experience of connection. It's a feeling of transcendence with the divine that fills the individual with meaning, safety, love, and connection to the whole. When I talk with young people who are struggling with substance use disorder or any kind of self-medicating patterns, when I talk to them about the bliss, the joy, the balance, the feeling of transcendence, and even divinity that occurs when they participate in their self-medicating behaviors, they are absolutely riveted to that. They become so accustomed to the shaming lectures, to the pathologizing of the substance use or the self-medicating behaviors, that when somebody honors what it serves, that absolute human need that it serves for this spiritual experience of connection to others and to everything, they realize that they're not weak or compromised individuals merely, but that they are these amazing creatures who are just trying to find something bigger than themselves, something more wonderful than themselves. The problem is they're just finding it in poison streams, if you will. They are thirsty and drinking from poison streams. The mitigating contribution that we can make as anybody to people suffering from repetitive, habitual, dependent self-medicating behaviors is how we are with them. It's not just the thing that happens to them. Yes, sexual assault, physical abuse, learning disabilities that show up in the academic setting. Yes, all of those things. And the list is longer than that. Death of a loved one, those are real traumas. But what can mitigate that is if you have this capable parent who's done their work, who knows how to be with somebody else in this way that fosters this secure attachment, this resiliency, this internal base. If you can do that, you can mitigate the trauma. My dissertation was about this. We looked at children of divorce and children where at least one parent was considered a problem drinker. And when we entered the variable about where the participants in the study answered the questions about whether or not they were seen by somebody, understood by somebody, supported by somebody on a fairly consistent basis over a long period of time, if they had that, even if another parent, or even if that was from a grandparent, if they had that experience of being seen, we could not tell the difference between the child of a divorce, the child of an alcoholic, or somebody that didn't experience those things. I did this dissertation 30 years ago. Had no idea what I was doing. My professor just kind of walked me up to it and had me do it. And now I can see it. Now I can understand it. This is where resilience comes from, principally, or at least this is our contribution to it. It can also be organic, genetic. It can be based on the person's nervous system that they're born with. But the part that we have some control over, any control over, is how we show up. Providing connection and containment. Containment meaning boundaries and limits, but containment also meaning that it's a word from psychoanalysis that means I can hold your pain. I can hold your sadness. I can hold your grief. I can sit with you. I can offer you. The great Mr. Fred Rogers talks about we don't offer each other our silence enough. And when I work with people who are grieving, doesn't matter if it's clients or my own family, my own loved ones, my friends, the thing that I offer, that I think I feel, I sense that people appreciate the most is my presence, my ears, my listening, my quietness. We learn to connect through ourselves by connecting through others. Jessica Benjamin, a scholar in attachment, taught that the root of the self is almost always found through another person. When someone sees us, we have the experience of there I am. And if that happens over a long period of time consistently, we can go out to the world and be who we are without the great threat, without a significant threat of rejection or abandonment. Because the base that was once external in the person of the parent is now internal in the person of the child. As one of my clients said not too long ago, we won't go after the wire monkeys, referencing the experiments with monkeys, Harry Harlow. We won't go to the wire monkey. We'll go to the soft, warm monkey who's offering us comfort. And the first thing that we have to do as parents, as partners, as people, as therapists, and I cannot tell you how many therapists don't do this either, is we have to do our work and connect to ourselves. We have to become ourselves to a certain degree. We can only help people as far as we've done the work ourselves. There's no exception to this. Because whether it's in your awareness or not, the unconscious is doing a lot of the communicating. The energy is there. And if you're afraid and dysregulated, it is really hard to get it right. And if you're content and secure, it's really hard to get it wrong. This is just another reason why telling somebody what to do, when people ask the question what I should do, why that doesn't work. Because if it's not authentic, if it's not real, if it's not based in the person's soul and psyche, then the person on the other end will feel that disconnect and feel even more unsafe and deceived. It's really important for me to teach this tonight. I'm going to say this as clearly as I can. Recovery from codependency, improving your own sense of self, your clarity about your sense of self, becoming more conscious does not cure addiction in anyone else. So if you're working a program, a therapy program, if you have your child or your spouse at a program, and you're hearing the message that if you get better boundaries, if your communication gets more assertive and clear, if you stop feeling guilt and shame as it relates to the person suffering from addiction, if you clean up those things, if you hear the implication, it might not be said, but if you hear the implication that if you do those things, then the addicted child or spouse or parent or brother or sister will get well, you are being sold a lie. The only thing that recovery from codependency does is it helps you recover from your own distress. And yes, as you recover from your own attachment wounding, your own attachment trauma, as you recover from codependency, those are all the different ways of saying the same thing. As you recover from that and heal from that, and as your nervous system is more capable of regulating itself, you're more calm and resilient. Yes, you're a better friend, you're a better therapist, you're a better spouse, you're a better parent. Absolutely. But it is not a cause and effect. The idea is, what can I do to fix my child? Is the disease, is the poison, not the cure. So we have to separate out our own work with theirs. We can see a relationship, but it is by no means a cause and effect. And I think many professionals, I included, have made the mistake to suggest otherwise. Ultimately, like I said, the goal is to not get distracted by the symptoms. Remember this: the self-medicating behaviors, the symptoms, the purpose that they primarily serve is to distract the person from the feelings that they're avoiding, that they don't want to feel. In other words, they provide a distraction. But that's just the primary gain of those behaviors. The secondary gain of those behaviors is they distract everybody else. If I'm 50 pounds underweight, right, or 100 pounds overweight, that's going to catch your attention. And so you'll be focused on that instead of focusing on what's going on inside of me, which if I'm in that symptomatic state, which I am very happy for you to be distracted, to be thrown off the trail, if you will. I believe the 12 steps are an incredibly effective way of treating addiction. In fact, I believe that the 12 steps we would all benefit from using the 12 steps. You know, I'm not going to read them tonight. That's for another broadcast. But I'm going to say the principles involved are the false sense of control, that we can control things. Instead, recognizing that that we can deal with things. It's not like, it's the difference between praying that the plane doesn't crash and praying that you'll have the peace and serenity no matter what happens. That's the difference. I think of substances or self-medicating behaviors as kind of a magic potion. Without any effort on the user's part, it makes you feel good. If you hand a magic potion to a 5-year-old, or somebody who, developmentally speaking, is equivalent to a 5-year-old, the chances of them misusing it are incredible. But if you hand that same magic potion to somebody who's spiritually, emotionally, psychologically mature, the chances of them becoming addicted to it are very little, relatively speaking. We learn to be present with the 12 steps. One day at a time is the phrase that is used. Do the next right thing. More will be revealed. They have all these slogans that remind us to be present. Surrender is a big part of it. Surrender and humility. Surrender isn't giving up and being passive. Surrender is saying, I need help. The problem is too big for me. I've tried to tackle it on my own and I'm having no success. My best thinking got me here. And when I'm working with a parent who's thinking about a child's self medicating behaviors or addiction, I'm always teaching them what surrender would sound like, what it would look like. Because if you get that surrender, that humility, that teachability, the rest of the work is easy. And so much of the 12 steps, especially the early ones, are about that surrender. There's a vigilance that comes from the 12 steps. Saying there's a lot of people today that will say, don't use the word addict, don't use the word alcoholic. There's a person struggling with addiction or struggling with alcoholism or with alcohol use. I'm fine with either one, and I honor both. And I try to use the latter so as not to upset the people that feel that way. But the people that walk into meetings and say, hi, my name is Brad, I'm an alcoholic. Or hi, my name is Brad, I'm a codependent. Or hi, my name is Brad, I'm an addict. It reminds me to stay watchful. I can't casually take a drink. My friend said it to me best. After many, many years in recovery and sobriety, my friend said, if I found out today, if somebody were able to convince me today that I was not an alcoholic, the first thing I would do is go and have a drink. And that makes perfect sense. So there's an awareness that is kept by constantly confessing and calling one an alcoholic. It doesn't mean that you're compromised and that you're not worthy. It just means I have this predisposition. I have this allergy. I have this thing that if I do and I don't pay attention to it, it can get the best of me. The 12 step has rituals, slogans, repetition. It gives us a sense of belonging, a sense of being in the group, which is part of what the substances are trying to replicate in the first place, that feeling that comes from connection. Being part of a group is really important. And not just being part of a group because of some superficial thing. It's walking into a group and confessing your mistakes, your sins, if you will, the things that you've done. And the group still welcomes you with love. That energy right there is in so many ways the healing balm. Getting rid of your secrets, as they say. You're only as sick as your secrets. This is about shame. Really, psychotherapy is all about dealing with shame. Once there's no shame, once there's no judgment, psychotherapy becomes exponentially easier for the client and for the therapist. It's the sentinels of shame and guilt and fear that prevent the growth. So disclosing one's secrets, getting rid of shame is a huge part of addiction, especially when there's a history of making horrible mistakes and hurting people. It's empathic without judgment. The 7 challenges were popular for a while, created by Dr. Robert Schwiebel. But really, it's just the same thing as motivational interviewing. It's the same thing as good therapy. It's not about confrontation. That tends to be for the person doing the confronting. It's about understanding. It's about asking questions. It's about being curious. It's about learning. It's really about connecting to the person so they can connect to themselves. Harm reduction. What I love about today's treatment world is that people are becoming more and more open to anything that works. And so when I have a client and they want to practice harm reduction, right? They want to believe and participate in social drinking, for example. My response is great. If it works, wonderful. I don't have any attachment to any one road. Refuge recovery is another source. I encourage you at the end of every broadcast to consider going to refugerecovery.org to learn about that. Smart recovery is another very practical, very conscious, commonsensical approach. Like I said, the core to the treatment, to the cure, if you will, is surrender. And not just for the child, but for you. changing somebody who suffers from addiction and their perspective. People quit drinking or using for the same reason they start drinking or using, to feel better. Rock bottom is nothing more than a change of perception where the abstinence is seen as a lesser distress than the use of chemicals. I often say to clients when considering big decisions, I say, do whatever's easiest. And people really get afraid when I say that. But I mean, in the long run, do whatever. If it's easier to drink, do that. If it's easier to stop, do that. Because that's what's going to happen anyway. Therapists, sponsors, and mentors that we trust can help us recognize old thinking patterns, not just a flare up, not just a relapse in terms of use, but getting back into the old thinking, because this is really a disease, a spiritual dilemma. It's about self deception. When we try to convince addicts of the fallacy of their thinking, it is like trying to tell someone that his or her belief in the law of gravity is a delusion. It's the height of futility to expect an addictive thinker to abandon that concept of reality and accept ours instead. Addicts must lose faith in their capacity for reasoning. They must accept the possibility of another version of reality from someone they trust. And that's from Addictive Thinking by Abraham Tversky. And my very favorite quote, and where I'd like to end tonight, is this one. The mother of a young man who was destroying himself with alcohol and other drugs could not understand how he could be so oblivious to the disastrous effects that chemicals were having on his life. She asked for help in dealing with him. But, she said, don't tell me I have to put him out of the house or that I should not bail him out of a jail. She said, I don't want to hear that. Abraham Tversky responded, please tell me how much is 2 plus 2, but don't say 4. She had been unable to see that her own thinking was no less distorted than her child's, than her son's. So we have to surrender. This is bigger than us. We have to unlearn our own thinking and conditioning. I know it sounds strange, but doing your own work is the greatest prophylactic and response to addiction in a family. Do your own work. If your spouse won't do it, do yours first. If your children won't do it, do yours first. If your parents won't do it, do yours first. We have to surrender and ask for help. We have to experience another context. The fish, they always say, is the last one to discover water. And when you have somebody in your life that's struggling, hold their recovery very lightly. Their recovery or lack of it, ideally, is not the foundation on which you build your house, your serenity. And it's all the same work. You have the same work to do, whether or not they get better or not. And if they stop using and they seem to have found recovery or healing from their self-medicating behaviors or from their addiction behaviors, and you haven't, you'll be just as miserable. You'll just find something else to fixate on. All right, folks. Thank you for joining me. I'll take any questions in my next broadcast, my next Q&A. My 2 books, The Journey of the Heroic Parent and The Audacity to Be You, are available on Amazon and Audible. If you want to do a deep dive into your own work, like I've mentioned, April 10th is our Finding You. We have an online version. May 17th is that. We have custom Finding Connection for couples and co-parents also, and also custom Finding Family workshops or intensives for families. Contact intensives@evoketherapy.com to find out more. For parents of our wilderness program, current parents or alumni parents, we have support groups each week. March 21st, tomorrow night at 7 p.m. is the next offering. Once a month, we have an alumni parent only meeting. April 15th at 6 p.m. Mountain Time is that next offering. And then our intensives and coaching support group is once a month. April 8th at 6 p.m. Mountain Time is that offering. You can go to our website, use the QR code here on the screen, or you can email supportgroups@evoketherapy.com to find out more. We have coaches that are available to do virtual coaching anywhere in the world. You just contact us at coaching@evoketherapy.com, and we can match you up with one of our 40 or so coaches who know this work, who know this attachment-based work, and can help support you on your journey. We ask all current parents to just try. If nothing else, you'll know what it's like to walk into a room where you feel vulnerable, where you're the newcomer, just like you've asked your child or your loved one to do. Any combination, 6 of any combination of the following 12-step support groups: Al-Anon.org, CODA.org, FamiliesAnonymous.org, or AdultChildren.org. Also, like I mentioned earlier, RefugeRecovery.org, or the National Alliance on Mental Illness, NAMI.org. All these broadcasts are available on your favorite podcast app or Spotify. Just go to those apps and search Finding You and Evoke Therapy Podcast and like and subscribe there, and you'll find out when the new episodes drop. You can also go to soundcloud.com on your computer and listen there, or you can go to Evoke's YouTube channel and watch the rebroadcast of the video versions of these with the slides. You can always request the slides by emailing us at webinar@evoketherapy.com. You can find Evoke Therapy programs or me, Dr. Brad Reedy, on X, Threads, and Instagram using the handles @EvokeTherapy and @Dr. Brad Reedy, respectively. And Evoke Intensives on Instagram, you can find by searching @Evoke Therapy Intensives. You can find us on Facebook by searching Evoke Therapy programs or Evoke Therapy Intensives. And of course, our website has a wonderful blog that's not just about teaching you, but about our own staff, our therapists, our employees sharing with you about their own journey, because that's a culture that we try to foster. All right, folks, my next broadcast will be March 26th, next week at 6 p.m. That's a Q&A that's live for siblings, family, and friends. You can send in your questions in advance to webinar@evoketherapy.com. Those will go to the top of the queue. We have some left over from last night's broadcast. We might have some left over from tonight, and I'll address those in the order that we received those. So contact us via that email address, webinar@evoketherapy.com, for questions, comments, suggestions. I hope this was a helpful point of contact. And as always, for on behalf of the people that you love and the people that love you, thanks for showing up tonight and being willing to do your work. It makes all the difference in the world. Have a great evening, and I'll talk to you next time. Bye-bye.